Dry mouth. While using the CPAP system to treat sleep respiratory disorders such as obstructive sleep apnea or OSA, is and has been one of the most significant issues for patients, forcing them in some cases to stop using the CPAP machine and in this way hurting themselves by missing the treatment required to prevent, for instance, cardiac and cerebrovascular diseases. CPAP therapy is the first line of treatment for sleep respiratory disorders. Due to patients' complaints, many improvement has been obtained and implemented, and in my experience in the sleep lab, one of the most significant in resolving the dry mouth issue is the heated humidifier. The heated humidifier has been part of your CPAP system for many years. It will keep your mouth and surrounding tissues moist, allowing a better adaptation to the system. Remember, if you use a full interface, the right level of heated humidifier will be a solution to eliminate the dry mouth, always ensuring that the mask seal around your mouth is appropriate. On the other hand, if you use a nasal interface or mask and you are a mouth breather, you will also need a chin strap to keep your mouth closed and the heated humidifier at the right level.